Hello everyone, welcome back to the channel. Today we are diving into the topic that many men may experience but often feel uncomfortable discussing: erectile dysfunction or ED. It's more common than you might think. We'll be comparing the two popular medications used to treat erectile dysfunction: Tadalafil, known as Cialis, and Sildenafil, commonly called Viagra. We'll cover how each works, the best time to take them, potential side effects, and which one might be the best for you. So let's jump right in. Erectile dysfunction is when a man has a difficulty getting or maintaining an erection. It can affect men of all ages, but it's particularly prevalent among older men. According to research, about 52% of men aged 40 to 70 report experiencing some degree of ED. This issue can arise from various factors. Main three factors that leads to ED are: physical factor. Conditions like diabetes, high blood pressure, heart disease, and obesity can affect blood flow and nerve function, ultimately leading to erectile dysfunction. The second is hormonal factor, particularly testosterone. Low testosterone level can contribute to erectile dysfunction. And number three is psychological factors. Stress, anxiety, and depression can impact your sexual performance. So understanding these causes is the first step in finding the right treatment. For many men, medications like Tadalafil and Sildenafil can be effective solution. Now let's talk about Tadalafil or Cialis. This medication is PDE5 inhibitor, which means it helps relaxes the blood vessel in penis, allowing for increased blood flow when you are sexually aroused. So let's see how it works. Tadalafil prevents the breakdown of substance called cGMP, which is essential for the smooth muscle relaxation in penis. When you are stimulated sexually, this increase in blood flow leads to a stronger erection. Now, how to take Cialis? Cialis or Tadalafil can be taken with or without food, which is convenient. The standard dose is usually 5 to 10 mg taken before sexual activity, but some men may take lower daily dose on regular basis if they plan to be intimate more frequently. When to take it? If you're taking it on an as-needed basis, take it at least 30 minutes before sexual activity. However, one of the great advantages of Tadalafil is that its effect can last up to 36 hours, allowing for more spontaneity. Next, let's discuss Sildenafil, commonly known as Viagra. Like Tadalafil, Sildenafil also helps improve blood flow to the penis. How it works? Sildenafil works by blocking the same enzyme PDE5 that Tadalafil does, allowing for more blood flow when you are sexually aroused. How to take it? Sildenafil or Viagra can be taken with or without food, but it's best to avoid heavy or fatty meal as they can delay how quickly the medication works. The typical starting dose is 25 to 50 mg, taken about an hour before the sexual activity. When to take it? For the best result, take Viagra about 30 to 60 minutes prior to the sexual activity. However, its effect typically lasts around 4 to 6 hours, so it's more suitable for planned events. Now let's look at how effective these medications are. Both Tadalafil and Sildenafil has been shown to work well for many men. Let's compare the efficacy of both the medication. In clinical studies, about 81% of the men using Tadalafil reported improved erection, while around 74% of those using Sildenafil has similar positive experience. This number suggests that both medication can significantly enhance your sexual performance. The other difference can be patient satisfaction. Many men find both medication effective, but personal preference will play a huge role in which one to choose. Some may prefer Tadalafil for its longer duration, while the other might favor Sildenafil for its quicker onset. Like any medication, Tadalafil and Sildenafil comes with potential side effects. Here are some of the common ones for both the medication. Headaches. This is often due to increased blood flow. Number 2. Flushing. Some men may notice a warm feeling or redness in their face. Number 3. Indigestion. Stomach discomfort can also occur with these two medications. Number 4. Nasal congestion. Changes in blood flow can lead to stuffy nose, makes you feel stuffy. Serious side effects are rare but can include a prolonged erection known as peripresum, which requires immediate medical attention. If you experience an erection lasting more than 4 hours, seek help right away. It's crucial to be aware of drug interaction and safety consideration. When taking this medication, if you are on following medication, then please talk to your provider before starting ED medication. The first one is nitrates. If you are on medication for heart issue that contain nitrates, combining these nitrates with Tadalafil or Sildenafil can cause dangerously low blood pressure. This is a serious risk, so always inform your doctor about any medication you are taking. And the second one is alpha blockers. These are the medications that helps lower blood pressure. If you are taking them alongside Tadalafil or Sildenafil, you may need to monitor closely for blood pressure changes. To get the best result from Tadalafil and Sildenafil, keep these tips in mind. Number 1. Consult your doctor. Talk to your healthcare provider to figure out which medication and dosage is best for you. They can consider your health history and any other medication you may be taking. Number 2. Timing. For Tadalafil, you can take it about 30 minutes before sexual activity or opt for a daily low dose option for regular use. For Sildenafil, take it 30 to 60 minutes before you want to be intimate. Number 3. Healthy lifestyle choices. Eating well, staying active, and getting enough sleep can improve your overall sexual health and effectiveness of this medication. Number 4. Moderation in alcohol consumption. While a drink here or there may not hurt, excessive drinking can impair your ability to achieve an erection. So moderation is the key. Now let's address the common question. Which medication is the best choice for you? If you prefer medication that lasts longer, Tadalafil might be your best bet. With the effect that can last up to 36 hours, you can enjoy more flexibility in your intimate moments. If you want something that works quickly for planned encounter, then Sildenafil may be the more suitable with effects lasting around 4 to 6 hours. Ultimately, the best choice depends on your individual preference, lifestyle, and health status. Consulting with your healthcare provider can help you make the right decision. In summary, both Tadalafil and Sildenafil are effective treatment for erectile dysfunction. They work by increasing blood flow to the penis, make it easier to get an erection when sexually stimulated. Tadalafil offers a longer duration of action, while Sildenafil acts faster but with a shorter window of effectiveness. It is important to talk to your healthcare provider to determine which option suits you best based on your lifestyle and medical history. And remember, both medication requires prescription, so don't hesitate to seek professional advice. Thank you for joining us today to learn about Tadalafil and Sildenafil for erectile dysfunction. If you found this video helpful, please give it a thumbs up and subscribe for more information on men's health topic. If you have any question or want to share any personal experience, drop them in the comment below. We would love to hear from you and see you in the next video.